Welcome to the TechLink Health Podcast, an on-demand source for the top trending healthcare topics and insights. Delivered by key opinion and emerging leaders and as featured on the TechLink Health app. The healthcare industry is rapidly evolving, so our goal is to connect listeners to the most relevant insights, ranging from digital health to financial well-being to interesting side gigs. For more details, visit www.techlink.health.
Hey everyone, welcome back to the TechLink Health Podcast. I'm Justine Reese, and today's episode focuses on the role digital marketing plays in connecting healthcare consumers and practitioners in the quest for healthier outcomes. This episode's guest is David Sanchez, who is a practicing registered nurse, CEO of Life Transformation Recovery, and founder of Digitalis Medical, a growth marketing agency specializing in healthcare SEO, content marketing, and medical blog writing. His mission is strongly tied to helping practitioners to achieve more online visibility and connect with new patients while building greater trust. It goes without saying that David has value-added expertise in the digital health marketing and advertising domain. So without further delay, we're excited to welcome David Sanchez to the podcast. David, thanks for joining us today.
Thank you. I'm excited to be here.
To start and give our listeners some background, can you take a moment to introduce yourself in a bit more detail and tell us about your journey in digital health marketing?
Yeah. People always ask me, how the heck did you get into SEO or digital marketing? SEO is search engine optimization. Everybody wants to be on the top of Google. So that's what SEO is all about. But gosh, that's a long distance from being a nurse. So I graduated from nursing school in 2009. So I've been a nurse for about 12 years. And just a few years in, I was working in the emergency department in Phoenix at a big organization. And then also where I live now in northern Arizona in the Prescott area. So in an emergency department, you see so much human need, people just at their lowest point in life. That was really when the opioid epidemic was really hitting our area hard. And we're one of the biggest channels from Central America and from Mexico up. We're in a major trafficking thoroughfare for drug trafficking. So I would see people all the time, every day, overdosing or just coming in asking for help, needing to detox. And there just weren't any affordable resources besides giving somebody a list of local AA meetings to go to. It was just really hard for people to find help that they could afford if they didn't have a lot of cash or great insurance. So I started a nonprofit called Life Transformation Recovery. I was helping people get their lives together one piece at a time. And in
One
2015,
step at a time, right? As they say.
Exactly.
Mm-hmm.
Yeah. So I opened it was a clinic. So offered counseling, detox, and also housing for men and women, and really helped a lot of people. But in that journey, I didn't have any idea digital marketing wasn't on my radar at all. I just wanted to help people. But as a nonprofit, I didn't know that rehab centers, detox centers, um, rehabilitation, it's an extremely competitive field. The only thing more competitive than that in digital marketing is the legal industry, which lawyers, you see billboards everywhere for lawyers, but the next thing below that, as far as competitiveness, is behavioral health or addiction treatment. And you're talking like $100 to $120 a click.
Wow, that is fascinating. I never would have thought that.
It's insane. And I had no idea, but I was like, oh my gosh, I got to figure this out. I got to learn this because we're trying to help people. We're a nonprofit. We have a limited budget. And so I had to figure out search engine optimization. I was hiring agencies to help me, hiring web designers to help me. And I just wasn't getting the quality that I was looking for. And so after I started digging in and learning it in like 2015, I said, you know what? I can get my own team together. We can do a better job than these companies I'm working with. So I got my own team together, and that became Digitalis. So we're a growth agency, and there's a lot of different terms that people throw around: digital marketer, digital whatever. But basically, growth marketing is like growth hacking. You have a budget that you want to work with, you have a goal that you want to accomplish, and you want to find the most efficient, quickest way to get there to be able to reach your mission. And that's really what I'm all about, because I'm here to help people. Nurses naturally want to help people. That's why we get into the nursing field. But no matter where I'm at, whether it's my business or as a nurse working in the emergency room, which I still do, I'm all about helping people and doing a great job. And, that's really what I love.
Do you find that because you are still an active RN, that constantly is changing because you're seeing what's currently in need? And I can only imagine how 2020 and going to 2021 with the pandemic must have affected your strategies.
Oh gosh, yeah. Yeah. You know what they say. It remains a fluid situation.
Or let's
That's
pivot.
become a
We're
cliche now,
pivoting. I hear that a lot too.
Yeah,
Yeah.
exactly. So there's been a lot of pivoting and a lot of fluidity.
Yeah.
but
We're all
it's
basically on surfboards.
lots of needs. Yeah, exactly.
That's really interesting. So tell us, can you discuss some of the proof points with your methodology in regards to promoting healthier outcomes with Digitalis Medical?
Yeah, sure. Over time, you see that people, as we have experiences in life, we kind of form belief systems around that. One of the Google searches for a blog post that I wrote was, I don't trust doctors anymore. And so I wrote a whole blog post on why people don't trust doctors anymore. And a lot of it has to do with the health industry, regulations, Medicare and Medicaid. And a lot of it is because doctors aren't able to spend time with patients anymore, or very little time. So doctors that do, man, their reputation just soars because of that. Marketing is not just advertising and salesmanship and stuff like that. The goal is to earn trust. When you have people's trust, then they're willing to talk to you and they're willing to listen to what you have to say. And people want to know that you care before they are really willing to trust you with their, physical health and that sort of thing. So marketing, from my perspective, the way I approach it, first of all, is all about earning trust. And then in what ways do we need to earn the trust? Because people are using different channels. They're spending time in different places than they used to 20, 30, 40 years ago.
Yeah, that's really true. And so what are the different avenues that you find and how do you get that reach?
Yeah, there's a lot of different approaches. As a growth marketer or a growth hacker, I focus on who is your target audience. So who are you actually trying to reach? Who's your ideal patient or customer? How old are they? Do they tend to be male, female? Where are they physically? What media do they use? So the most common, if someone's searching for something like a local facility, let's say they have a knee pain or something's bothering them, or they know they have a gallbladder problem and they're trying to find the right specialist, they're going to be making a Google search most of the time, because Google totally dominates the search engines. So that's what we call user intent. When someone's actively looking for something, you want to be where they're looking for you. And that's when somebody's ready to actually make a decision. So what I have is like a palette basically of different options, and I put together a customized plan to touch people at each of the spots where they're most likely to actually earn that trust, or they spend their time and actually ready to make a decision to work with a provider or a company.
And how does your experience and recovery play into your strategies now that it seems like you're opening the door much wider to different needs for someone looking for the right fit?
Yeah, so I focus on healthcare, but as you know, healthcare has a lot of different subspecialties. I help all healthcare specialties, but in behavioral health, psychology is a huge part of it. And the important thing is to understand people. What do people need? What's bothering them the most right now? And what can we do to help meet that immediate need and also serve them in the long term? So it really is combining both of those.
It sounds like it's about like most relationships. You're building relationships, but on such a wide net. One of the primary drivers for a new health ecosystem is the raising cost of healthcare and accessibility at global scale. When you think about the future of healthcare with regards to quality of treatment and cost, what does that look like? And what roles do RNs play in that emergence of new technologies that help reduce the cost, such as telehealth that we were talking about earlier and remote patient monitoring?
Yeah, I think what we're going to see a shift in healthcare technology towards a lot more end user testing, because nurses are the biggest profession in healthcare as far as people that actually use equipment, use supplies, use softwares, and actually work at the bedside with patients. They spend most of the time doing that more than anybody else. Not just nurses, but nursing in general. So that could include nursing assistants, technicians, that sort of thing.
So do you feel that being an RN, you've had more contact with the patients on a one-on-one level than even sometimes the doctors do?
Oh, no doubt. Yeah, I'm the interpreter. Even though we're both speaking English, I'll be there with the doctor, and the doctor says, "This is what's going on," but they're speaking Latin the whole time, right? This is your diagnosis. This is what we saw on the MRI or the CT or whatever. And then they walk away, and the patient looks at me. What did they say? What's going on in plain English? And so they really need someone to interpret things in a language that they understand. And we want to simplify things.
That must be very humbling. Do you speak Spanish? That must help a lot in those situations, I would imagine.
Oh, definitely. Yeah, absolutely.
Do you use that in your marketing sometimes?
I don't think I've used it in my marketing because Google automatically translates everything for you on a website. That helps.
That is true. One point of view with the TechLink Health Initiative is that the interoperability of technologies, data, and people will shape the landscape of the future. Tell us your perspective.
Yeah, that's huge. A common word that we use that means similar thing, I think, is integration. Things need to fit together. Healthcare is a huge puzzle, softwares and technology, and everything's so separated. And like I was saying before, I think that like having nurses involved with actually using things as they're being built, they'll focus more on user experience so that people that are actually going to use it will be saying, let's remove these 15 steps in the middle. Let's make sure it's working smoothly. Let's make sure it's efficient and works well and seamlessly when we're actually using it in real life.
That's great. So, another important part of this perspective is building an ecosystem of side gigs. Tell us about your journey into non clinical entrepreneurship and how do you balance that with the actual clinical work that you're doing?
Yeah, that's pretty big. And starting out, if a nurse is interested in doing that, I wouldn't recommend just going head first because you have to have some sort of income, right, to pay your bills. So,
Right.
so when I
Yep. I always say, yes, it's like when you want to do something creative, you need to have something that's like your parents paying for college or paying for your
yeah, that
training,
would
right?
help. Yeah, so I was working in surgery as an operating room nurse when I started life transformation recovery, and then what I did was I transferred to the emergency department, which I'd already worked at before, but I transferred there as a stat or a float pool position. So I was able to pick up as many shifts as I wanted to if I needed the income, and even though it was full time as an entrepreneur, that allowed me to help out with revenue at the same time if I needed to. The thing is, if you're going to be doing side gigs, it's additional time and energy, and everything takes something out of you. You only have so much time in life. I only have so much time to enjoy with my kids. I'd rather have a little more control over my schedule than the hospital does. And so the way I see it is nursing is not a calling. I don't view it that way. In a lot of times in nursing school or in training, we were taught nursing is a calling. This is the greatest thing ever. Well, I don't believe that. I believe that it's a way to, as a career, that you can help people. But I was helping people very effectively with the rehab center. I'm helping healthcare businesses grow by helping more patients with the marketing agency. And so I think we just help people in different ways everywhere we go in life. And that's what the free market is all about. It's about helping people in creative ways to help meet their needs. And so if you're going to approach something, if you're going to want to do a side gig or a side hustle, I totally encourage that. The main thing is that you're helping people with something that you enjoy. And there's also a reward with it. You have some flexibility that comes with that. And that's what I love about it.
It's so amazing, David, to turn something that's being of service into a side gig that is actually a passion, but that also is giving back constantly. I have to ask this question because you can't turn away from the last year and see how we've all done everything from our computers. And medicine, of course, was at the forefront because people couldn't get in to see doctors, it wasn't safe. How did COVID affect your business? And how was the receptivity of people not only marketing online, but literally having interactions with their doctors online?
Yeah. Well, I definitely didn't lose any business at that time because people were so shaken up. There's a lot of other marketing and advertising efforts people were doing that just totally went away. We couldn't go to conferences anymore. There were no trade shows. And so people were forced to go online, either accelerate that or just kind of not do anything and watch and wait. I had one client that had stopped working with us. I think it was November, so right at the end. And then just a few months later said, okay, now we're seeing more patients than ever, despite the fact that I can't do any of my other marketing I was planning on doing, because the work that you already did is snowballing. With SEO. It snowballs and it builds. And he said, we've got to get started again.
That's so fascinating. I remember I mentioned this to you earlier that even certain doctors that weren't even willing to do online telehealth, it was too confusing. Maybe someone who had just never operated in that space, now they're refusing to go back. In the therapy space in particular, I know very few therapists that are choosing, they're not paying their rents anymore. So they're like, why? This totally works. I mean, there's something to say for being in the room with somebody, but it's allowed people to have more time. I think you nailed it when you said that.
Yeah, the flexibility, it really is amazing. It changes everything. I've had an all remote team since the beginning. I did have a physical office, but I didn't really use it at the beginning for a couple of years with the agency. But since then, everybody's been working from home. And the crazy thing is then it was like, oh, what kind of agency would work from home? Why would you not have a physical office to meet clients? But now it's become so normal. Who cares? The main thing is whether you're helping people and you're accomplishing the goal.
Definitely, I hear loud and clear, follow your passions, even in your side gig and your main gig. Is there anything else you can talk about just more specifically about how you do SEO for a medical company that needs more visibility, more outreach?
Yeah, sure. Yeah, so I have a 5-step methodology, and I don't want to get into dig into it too much. But
Don't
first
want
of
to give
all,
it all away, David.
I can try to give it all away, but everybody would be sleeping by the end. That's why I do it.
That's right.
because I enjoy the strategy and dealing with minute details.
Yep. Well, that's what you get paid for, right?
Yeah. Yeah. So it's first of all starting out with who do you want to reach? What's the goal of your business or your practice or facility? Who are you trying to reach? Who are you trying to help? What language do they use when they're searching for your type of service?
So those keywords type of thing.
Exactly. Yeah, keywords. But there's millions of them, but the question is what's has the highest value for you? If you're a surgery center and specializes in knee replacements, or if you're a hospital that specializes in heart cardiac care, you're going to want to focus on the keywords first of all that people are actually using in your area, in your city. Not in a city across the country. The language might be slightly different, even in the US. I pay thousands of dollars a month in software where I can see exactly what people are searching for in any given city or any given zip code. And so you want to focus on the keywords that are appropriate for that area, and then also the ones that have the highest intent to actually make a decision. Like a heart doctor near me, that's pretty specific. Instead of like, what is the heart, or that sort of thing. That's more generic.
When you started building this, did you focus on certain areas like locally in Arizona, or have you always been a national? How do you start being able to attack those different areas geographically?
Yeah, most of my clients are in Arizona just because word of mouth travels that way geographically, but I definitely have worked with a lot of national clients also. It just depends on who they're trying to help and how their business works, but I definitely work with clients all over the nation.
Great. So, are there any final recommendations for those interested in staying connected to the next wave of innovations within healthcare?
Yeah, I would stay connected to tech, health blogs and news like TechLink Health. You want to be connected to what's actually going on. You need to have a pulse if you're interested in that area because there's so much innovation going on. And I think all of us agree that we're not going back. I don't think things are returning to the way things were. Like paper charting, paper documentation, a lot of manual stuff is going away. Things are so much more connected. There's a real momentum that's really exploded, exponentially in the last couple of years. I don't think we're ever going back, and it's just going to improve from here.
Yeah, my father is a radiologist, and my summer job was working in his office, and rooms of files and files and files and files. And of course, we developed actual X-rays. All those are digital now. I mean, everything's just gone digital. It's sort of amazing.
Lightning speed.
Right. And then that's the other thing, the trend with all the COVID testing centers. Did you do a lot of that when everybody just needed to get their COVID tests or when vaccines came out? How on the cutting edge of those efforts were you?
Yeah, I was right in the middle of it. I was working full time. So three shifts a week, 3 12-hour shifts in the emergency department. We had a tent outside where we were testing COVID patients that did not need to be in the hospital right that second. They helped us to separate them. I mean, we had times where there were easily half to 2/3 of our patients were there to be COVID tested when it was really spiking a lot in our area at the end of early 2021. And there were times when we were completely over capacity. I had one 15-minute moment in time there where I was working in the area where the people are sick enough they have to be in the hospital or in the emergency department in a room because they're critically sick and not breathing well. But we had to, isolate that area and isolate a room. So I had one 15-minute period of time where I had 3 patients that came in like back to back to back that I had to just go grab and just put in a room because their oxygen was between 50 to 70%. And they were probably within minutes or hours of dying. And we just had to get them stabilized as fast as possible. We don't have time to think about it. You just got to do what's necessary to make sure these people don't die in the waiting room. People were waiting overnight in their cars just to see a doctor. But, the sickest of the sick, we had to get them back to get them stabilized.
And I'm sure there was a lot of grief counseling that went into your job, even though that wasn't necessarily your job. But
yeah. And there were no visitors. That was one of the hardest things is people can't visit unless it was an end of life situation. If they have COVID, can't have it spreading. That was very tough. So basically we were the only ones actually with the patients, talking to the patients.
I ended up speaking with a nurse, and I feel like she may have been in the Arizona area as well, because you guys had some pretty serious spikes, who was telling me that patients were coming in and they maybe didn't even speak English. And one day it was the mother, and they had to tell family members what was going on, or maybe they passed away. And then a week later it was the father. Things like that kept happening. Did you see a lot of that?
I've definitely seen that. Yeah. I haven't taken care of multiple family members that were dying, just because in the emergency department, we take care of people where they're at, and then we don't see them after that. And we can't, because of privacy laws, we can't do any further research. So we really don't know how they turn out most of the time.
Well, I think it's amazing what you're doing and having a greater outreach. In closing, any last words towards giving hope to other RNs that might want to do what you're doing to have more freedom in their life? I really love your approach that building trust is what makes marketing work. And really, that's kind of a good litmus test to use in life, right?
Yeah, definitely. I'm always available on LinkedIn. If anybody has any questions, I'm happy to schedule a phone call or a Zoom. My link there is, David-Sanchez-RN. So that's a pretty easy person to find. So happy to talk, happy to help anybody who wants to explore a little more. Maybe see if there are other options besides clinical nursing.
Well, thank you so much for coming on today. It was great talking to you.
Thank you. It was a lot of fun.
Thanks for listening to this episode. TechLink Health is a healthcare advisory platform for consumers and organizations to stay informed with the latest insights while connecting with healthcare experts for telehealth, e-consults, and consulting services. For more details, visit www.techlink.health.